And this is the last video in a set of series about Ehlers-Danlos syndrome. We see a lot of people who could possibly have that because they have multiple widespread issues. We went over those in video number 2. By no means is that an exhaustive list. The list I got, it was actually from the blog Twist standing for That's Why I'm So Tired. So if you want to, you can get on her website, Twist, and you can see the full list, which I did not get through. I got through maybe a third of it, and it was like 10 minutes, and I'm like, okay, people are gonna get bored and check out. So anyway, so today I wanted to talk to you a little bit about kind of what you might do and how PT can help, okay? So even if you don't fit all the criteria, but you recognize yourself in some of these things, you may want to talk to your doctor. This is a spectrum, okay? So you may still have issues without the actual diagnosis. So you might have hypermobility spectrum disorder, or HSD. And we don't treat that a whole lot different than we do with somebody that actually has full-blown EDS. And there are people who have EDS who function really well. I have EDS and I'm able to work full time. There are other people who are on disability because their symptoms are so bad that they can't work. I consider myself very lucky. So it's a whole spectrum. So even if you don't fit that criteria, you can talk to your doctor or a knowledgeable physical therapist about this possibility. You can find a geneticist or a primary care doctor, or even sometimes pain doctors will advertise that they specialize in EDS because it is a painful disorder. They should be willing to genetically test you or at least sign off on the clinical diagnosis for the hypermobile type. Okay. This doesn't change how we treat though. Okay. So even if you have this, there are reasons, like I mentioned in video number 3, that you might want to know so that you can pass on to your kids things like uterine ruptures during pregnancies, things like that you might want them to know about and be aware of so that they can watch for it and be careful of it and be able to address it right away and not be surprised by it. Those kinds of things, or decide not to get pregnant and maybe adopt instead. Whatever, the possibilities are endless what you do with the information, but a lot of times it's good to have that information. But again, it doesn't really change how we treat you. There is really no cure, and we're still just treating your symptoms. But it's also helpful to know because if you go, like a lot of us have issues with medications. We don't respond to medications the same way other people do. Some of us can take as much as it would, down an elephant, and it doesn't make a dent. It doesn't, and others, you take half a baby aspirin and you feel tons of effects. So it really varies across the spectrum, and so it kind of can help the doctor understand if you're not responding to medications, or if you're going through surgery, and the anesthesiologist knows, then he or she may be able to try a different anesthetic if the one that he or she is trying isn't working. So that can help. You also scar differently, so healing may be different than the average person. And lastly, it's really nice to know that you're not a hypochondriac, that you're not crazy, that you're not making this stuff up. So mentally, it makes a big difference, okay? Common team members are pain doctors, geneticists, allergy doctors, because of mast cell disorders, which can co-occur with EDS, gastrointestinal doctors for IBS, which commonly co-occurs with them, cardiologist or electrophysiologist, autonomic neurologist, physical therapist, occupational therapist, and dentists, depending on what your symptoms are and where your problems lie. Okay. How can PT help? Okay, so first of all, when we have loosey-goosey joints, we get information from where we are in space, from the length of our muscles and from our eyes and from the position of our joints. And if we have really loose joints, they may not fire the way that other people's fire, okay? So the way nerves generally work is that unless there's a change, they don't fire. So when you put your underwear on in the morning, you feel it, and then you stop feeling it. Thank goodness, right? And same goes with your joint. So like if it hasn't moved, you may not really notice where it is. You may remember where it is, but you may not notice. If you've ever been like falling asleep and you're like, where's my hand? And you have to kind of wiggle your fingers. Okay, that's that kind of thing. You know, we haven't moved your hand for a while, so you're like, where did I put it? I may be weird and just be the only person that ever happens to, but that said, the loose joints, they may not have enough pressure to actually fire those nerves, okay, and let you know that your arm is back here, okay? And this can lead to things like, you know, hitting your hand on things as you walk by because you're not really aware of where your hand is or where your body is, and so you walk too close to an object, walking into walls, walking into doorways, that sort of thing. And then, of course, because we bruise easily, we look like we've been beat up most of the time. So we can help with proprioception. We can, and that's the fancy term for that. We can help with that. We can help you learn how to stimulate those nerves so that they fire a little easier. We can help you to learn how to monitor where you are in space and rely on things like the length of your muscles so that you don't have to rely on the nerve endings in your joints quite as much. Okay, so we can help you to learn where you are in space. We can help you with movement guidelines and joint protection. So a lot of times, you know, you reach out, you open a door, if your arm is straight, if you have EDS and you go to open that door, you're just making your arm longer. You're not actually opening the door. So we go through some joint protection techniques. How do you not stretch out those ligaments any more than they already are? How can you prevent injury? That sort of thing. How to begin to exercise. It's really hard when you have EDS to exercise, and it's really important that you exercise both sides of a joint equally. So if you're constantly doing push-ups and not doing anything to work on the back of your body, the stronger muscles in the front can kind of pull that joint kind of out of, it can sublux it, not dislocate it, but it can make it kind of come out of that socket just a little bit painful. And then the joint doesn't really work very well. So we can help you learn to exercise safely, okay? We can help you with dysautonomia tricks. So like if you have POTS where you stand up and then your heart starts to race, or if you have vasovagal syncope, which is where you're standing and you just all of a sudden faint. There are tricks that we can teach you on how to handle that so that doesn't happen. Visceral manipulation that we do here at the Kirk Center can really help with things like vessel compressions to make sure that joints and other parts of your body are getting the nutrition that they need. It can also help with pain because if there's a restriction somewhere and you're being pulled out of alignment, which is really easy to do with somebody who has loosey-goosey joints, right? It can help with pain and realign the body and help you function better. We can also send you to an occupational therapist who can help you find braces that will help you keep you from hyperextending that elbow or hyperextending those joints in your fingers. There are some really, really cool looking finger splints that look like jewelry that are pretty cool. Sometimes you can get insurance to pay for those. So we can do a lot to really help, and we can help you kind of suss out what other issues you may be having and what might be related, and help with referrals. So come see us if you have any questions about that, or even give me a call, shoot me an email. My email is ann@k4hl.com. So that's ann@kc4hl.com, not at. ann@kc4hl.com. All right. Hope to see you soon. Hope everything is going well, and I hope you learned a few things. Thanks. Bye.